And you can see he added some clear porcelain here. Then he adds, you know, different colors, different shades of porcelain right on top, creates all the halo effects and all the mamelons. And then he just, you know, uses some finishing stones to recreate all the texture on the surface of these teeth. And you can see how natural the texture and the stunning glaze looks there. And then we're ready. We're ready to now isolate our patient and now first make sure that these restorations fit in perfectly. And that's what you're seeing right here. I'm seating the restoration onto my preparations. My preparations, you can see the mark very visible, and there is the one of the porcelain veneers seated. Very nice, you know, very nice fit. I'm ready to try in all the rest of the veneers. Once I try them all, I go ahead and I just, you know, use hydrofluoric acid for, this is feldspathic veneer, so I'm using it for 60 seconds. I rinse the entire surface. I apply my silane. So I go through the whole 9 yards of the adhesive stuff that I'm not going to walk you through right now. But you know these better than I do. And then I select the cement that I want to use to bond my restoration. I'm always going to use for this type of restoration a single bottle of dental adhesives because I want to have a very thin layer of adhesive. And then I choose a very, you know, a good system. In this particular case, I'm using NX3 light cured veneer cement. And this is, you know, one cement that I like a lot. That has a try-in paste. And what I like about the try-in paste is that you have only three options. You normally are going to use the clear option. This is the option that I use here, but you know, you have sometimes you have one of these cases that you need to have a lighter shade. You need to kind of highlight a little bit the value of your veneer, and you maybe use a white cement. And what I like about the white cement on Nexus or NX3 compared to other brands is that it's not that frosty white and not like the opaque white that when you have a thin veneer, you'll see that white through your veneer, that very intense white. This has more of a natural looking tooth color white that really blends in, and I personally like it a lot. And here you go, you have all my porcelain veneers bonded to the surface of the teeth, and you can see all the intrinsic characteristics that the lab guy was able to, my lab tech was able to get into these veneers. Wonderful job by his wonderful crafted and gifted hands. And you can see here, these are the temporaries, and I'm just going to show you the before and after. And this is immediately after. This is actually not immediately after. This is 30 days after all 4 veneers were bonded. And I want to show you something. This is the canine. This is the patient's natural canine. And look at the gray and the white and the little fracture lines, and exactly the same things we were able to recreate. The lab tech was able to recreate. This is not me. This is the lab tech. You know, beautiful work, very nice, recreating all those minimal, those intrinsic features within teeth and making these just look very, very nice and natural.